All right, so I wanted to show you what a Google Gem looks like in Gemini. So I'm not sure if this is available in Gmail, but it's available in Gmail Google Workspace for Business. So if you're using Gmail for Business, you definitely have this feature. So all my businesses that are using Gmail, you can create something called gems. And let me show you my first gem over here, and it's going to be the first of many. This one is called Lior Health Insurance Blue Cross Blue Shield Global. And we all have, hopefully, we have health insurance. And this is going to be AI that's going to help me figure out, what my coverage is. Because whenever I go to a doctor or you go to an emergency room or anything like that, you have absolutely no idea usually what you're going to be covered for. So let me show you what this gem looks like. So I'm going to click on edit. And I called it Lior Health Insurance Blue Cross Blue Shield Global 2026-2027. And the description is this gem has access to my full insurance plan documents to provide, let's make this bigger, coverage answers. Here's a description. Here are the instructions. You have to give the gem an instruction. Think of the gem as a person, and think of the person as an expert in a certain field or a subject. So it could be a lawyer, it could be a doctor. In this particular instance, it's an insurance agent, health insurance agent, basically. But these are the instructions I gave it. You have access to my full health insurance coverage document, which I'll show you below in a bit. Based on this information, you can provide me coverage detail information and point exactly to where that coverage is specified in the coverage document. Now I scroll down, and what I did is I have a PDF of the 56 pages of my Blue Cross Global Insurance product, which, do we ever really read it? And when we do have to read it, does it make any sense? Not really. Actually, now that I think about it, I may want to tell it, dumb it down and explain it to me in easy terms. So, when possible, dumb it down and explain it to me in easy and clear terms. See what happens. And I also uploaded my ID card. The ID card has some information on the front and the back for prescriptions and copays and stuff like that. Now on the right-hand side, let me go ahead and update it first at the top right. On the right-hand side, you could test what it would look like when you pull it into a conversation. So let me say I went to the ER in China, again, because I have a global coverage with this Blue Cross plan. So currently I'm in China. I went to the ER in China. The visit cost was 45 yuan. This is all based on true information, by the way, so you're going to be shocked. And the IV fluids, I had food poisoning. IV fluids, antibiotics, and prescriptions totaled 400 yuan. What is my coverage? What do I expect to get back for paying this? So now I will send this question. Let's see what happens. By the way, that's true. I spent a couple of hours getting IV, consulting with a doctor, getting blood drawn, and it was literally like $70 for the whole thing. Would have been way over $1,000 in the US. And they were super nice to me. Let's see. Based on your blah, 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 premier policy, your emergency room visit in China is covered under the International Outpatient Hospital Care Emergency Room Prescription Drug Provisions. Coverage breakdown. Hospital fee. Covered at 100% after deductible plus $10 copayment. Policy reference listed in Schedule of Benefits, page 7, under primary care physician specialist. IV fluids, antibiotics prescription covered 100% of actual charges with no deductible applied. Specified. What to expect back for reimbursement. Total out of pocket, $66.20. This is, yeah, okay, probably. Deductible requirement, because your medical visit charges fall under initial outpatient care, they are subject to your chosen calendar year medical deductible. If you, I guess I have to give that information because it's not in the package. Deductibles a lot, $10,000. If you have already met your annual deductible, you will be reimbursed 100%, minus 10 pay. If you have not, those will cost will be applied to where you're certified in a deductible. So of course, surprise, surprise, I'm not going to get any money back for this, but that's fine. It was $66. Pay up front. Okay. Submit the claim. So you could see how amazing just having this gem ready to go is. And it's also available on the Gemini app on my iPhone. So I just pull up the gem and I can ask it right then and there. If I go to the doctor, if I do a certain procedure, and it will point exactly in the document, in the insurance document, what my coverage is. Of course, you always have to double check AI. Usually for a 56-page document like this, it should be like 100% correct. It shouldn't make stuff up. But yeah, this is a gem, first of many.